Well, the Washington, D.C. area is home to many African migrants from the countries affected by Ebola. Some of them are involved in businesses that cater to the African diaspora and others in their community. How is Ebola impacting their businesses? For some perspective, Chime Asonye, a commissioner with the Washington, D.C. Mayor's Office on African Affairs, joins us via Skype from Chicago. Chime, welcome to Africa 54.
Thank you very much. I'm glad to be here today.
Yes. Now, we're hearing, of course, like from New York, the Liberian community saying their businesses are being affected by the spread of Ebola worldwide. What are you hearing about the African community in the Washington, D.C. area and the surroundings?
Yeah, that's a great question. People are definitely being affected by Ebola in different ways. And when you think about it, especially for the African community, restaurants and things like that, people are scared to visit those particular places. Also, when people are trying to get things like food, rice, jollof rice, and things like that that they would produce, they have to face uncertainty in terms of agricultural sales from abroad, which are decreasing because people don't want to go to the farms and things like that. Also, there's price rate volatility. So even purchasing goods from Africa to be produced and sold here are really hard. So in terms of individuals going to the stores every day, they're scared. And in terms of getting products from Africa that individuals will sell at the stores, they all become harder when agricultural products decrease and there's price exchange volatility when you're trying to purchase goods and services from African countries.
Now, what is it, if at all, that can be done to help people appreciate that you probably are not going to just catch Ebola because you entered a store that sells African products?
Well, there's a lot of things. I think that one of the most important things is to understand that some of the greatest economic impacts in relation to Ebola aren't because of direct costs related to the health aspects of the crisis, for instance, like mortality or caregiving or associated losses with work. Instead, the greatest causes of economic impact happen to do with aversion behavior, which is behavior driven from fear of the disease. So reports and analysis look at past epidemics, SARS epidemic in 2000, 2004, the H1N1 flu epidemic 2009, and they say that they're responsible for producing 80 to 90% of the total economic impact of epidemics. So large-scale awareness about how Ebola is transmitted, understanding that it can't be directly transmitted, it's not an airborne disease and things like that that can be easily communicated and spread, but instead it has to be directly contaminated from blood, sweat, and things like that, should underscore the need that these places are safe, that it's really hard. We've only had one case in, two cases now have been reported. And so that the widespread fear should be tampered down. Along with that, I think that politicians need to be responsible in their rhetoric when they're educating the public in relation to awareness to Ebola disease. One of the things we have individuals saying is that it's important to say that it's a national health emergency. That's true. WHO and other organizations talk about it's the most important national health emergency of the modern era. But calling it a national security threat, or it's talking about how Ebola could spread through the borders, and that's why we need to secure the borders and things like that, really otherize African communities, Latino American communities, etc., and don't allow individuals to think that going into those spaces, in those neighborhoods, in those places of businesses are good because they can contact the disease.
All right, Mr. Asonye, thank you very much, Mr. Asonye, for joining us today.